as more measles cases are confirmed, people are wondering if they're protected. I spoke with doctors who were able to answer the community's questions. How do you find out if you received the vaccine? If you got the vaccine as a child, is it still effective? Is there a certain range of years where people who got the vaccine are no longer protected? And if so, what do they do? Most importantly, what is the county doing to keep people safe? Dr. Carl Mingus with Sacred Heart University says there are many ways to find out if you have been vaccinated. The most obvious way is to check through your immunization records. If they aren't on hand, you can go through previous schools you have attended or places of work. You could also request your records through the state's digital vaccine records. If all that fails, a blood draw can tell you.
Blood titer. So this is just a simple blood test where a doctor can look at the antibodies to see if you have immunity for measles.
Even if that shot was received years ago, it is still 97% effective, according to Shasta County Health Officer Dr. James Moo.
If you had what we call fully vaccinated, meaning that you have two measles vaccine, whether it's measles itself or MMR, you should be fully protected.
According to the National Vaccine Information Center, the first measles vaccine administered starting in 1963 only required 1 dose of a live attenuated vaccine or 3 doses of an inactivated virus vaccine. By 1989, the CDC updated the recommendation to 2 doses of the MMR vaccine. If you were born before those dates, you typically have what's known as natural immunity.
Before 1960s, majority of Americans and worldwide, people consider measles as a childhood infection. And by the time you're an adult, everybody, at least 95% chance that you have measles exposure and you have measles and you survive the measles, then you are fully immunized.
If you're nervous, Moo says it doesn't hurt to get a booster of the MMR vaccine, although it's not typically needed. To prevent further spread, Moo says the county immediately tries to identify early cases and isolate them.
And second thing is we have great healthcare partners. They help us. They know exactly what to do in terms of if somebody called and say, hey, I think I have measles, they will find the time and location that they could evaluate the patients without causing further spread.
Both Dr. Moo and Mingus remind people to call their doctor if they're experiencing the following symptoms of rash, high fever, a cough, runny nose, and red eyes. Live in Reading, Christina Mendez, the Northstate's News.